Welcome to More Than Miles. Whether you're on a run, driving, doing laundry, or cleaning your house, thanks for taking us along. On this podcast, we believe that our athletes are so much more than their body and sport. So we dive deep with conversations and expert interviews to widen the lens on what it means to be a happy and healthy endurance athlete. I'm Dr. Kate Mihevik-Edwards, physical therapist, author, educator, and former endurance athlete. Through 12 plus years of successfully treating thousands of frustrated athletes and navigating my own health struggles, I've learned so much, and I really can't wait to share it with you.
And I'm Dr. Kacy Sinders. I'm a physical therapist, runner, and advocate for mental health and endurance sports. As an athlete myself, I understand the endurance athlete lifestyle and the impact that injury can have on our daily rhythm. I'm also known for my T-Rex costume and Wiggle Wednesday series on Instagram. Our goal is to always keep our athletes healthy on and off the road. As a wise woman named Pink once said, let's get this party started.
Hey everybody, today we're going to talk about a topic which I love. It's one, I think I always say it's my favorite topic, but I love to talk about neural tension because neural tension is this concept that most people don't really know. And it's always surprising, when you do the slump test or another test on them and it's positive, people are blown away. So neural tension is a pretty big topic.
And it can be, addressing neural tension can be a big piece of the puzzle, especially for a lot of our chronic pain patients.
Absolutely. So most people that have been in pain for a long time, persistent pain, chronic pain, however you want to name it, there's usually something else happening. There's a lot of things happening, and neural tension comes on the scene when nerves aren't getting the movement, aren't getting the blood flow, aren't getting the space that they need to do what they do, and that's slide and glide through the tissues.
So I affectionately call nerves the divas of the body because they need things just so. And if something goes wrong with them, sometimes they can take a little bit longer to heal than other tissues of the body. So I affectionately call them the divas.
Yeah, and they're much more sensitive in general. So it's one of those things, if you give somebody a neural tension exercise, a slider or a glider is what we call them, if they do too many and they're overzealous, then they can also be in more pain. So you have to be very specific how you dose them when you give them to somebody.
Right, and to monitor their symptoms because unfortunately we're pretty good, but we're not that good. We can't guess what's going to be the right dosage all the time for certain people. We can see some people may do better with less, and so we can kind of start and err on the less side. But especially with our population, I have to come out and say more is not better.
No, not when you're talking about nervous system.
Like, do not do these multiple times a day. Do not do more than I tell you to do. Do not. Absolutely.
And we don't even like to say no around here.
I don't like to say no, but I really don't want them flaring themselves back up with too many nerve glides.
I know. And I always say, if you do too many, you're going to think, what the heck did Kate do to me?
That's true.
But it wasn't me, I promise. Okay, so let's break it down a little bit. It's really important that everybody understands what we're talking about here. So we need to talk about what the nervous system is because it's so huge and it's throughout the entire body. It's the most continuous tissue throughout the body. And the nervous system is broken up into pieces. So we have the central nervous system and we have the peripheral nervous system. And the central nervous system is the brain, the brainstem, the spinal cord. The peripheral nervous system is all of the nerves that come out from there. So they're coursing through the upper extremity, coursing through the lower extremity. They're the ones that help us with movement, walking, lifting your arm up, those types of things. And then we even have the autonomic nervous system, which is where your fight or flight place is, right? So that's parasympathetic and sympathetic nervous system. But what we're talking about today, and we're talking about neural tension, we're really, really focusing in on that peripheral nervous system a little bit more.
That's right. And so the way I explain this sometimes is, so we know if we put our joints in a certain position, we're going to stretch certain muscles. And it's the same with the nerves. We have a certain series of movements that we can perform to gauge how tight is this nerve, how well is it sliding, gliding through the tissues. Because like you said, this is omnipresent. Like our nerves are everywhere in our body, and it's just something I don't think we necessarily think about as much.
No, we definitely, I think about it all the time, but most people don't think about the nerves as much as maybe we should. We give all the credit to the muscles. So a lot of times people will come into the clinic and they'll say, my hamstrings are so tight. They've always been tight. My entire leg is really tight. That's a moment where I might say, okay, let me look at your neural tension and see if that's a component. And again, this is that whole idea of everything comes back to the back. So then we test their neural tension, and what we actually find is that that test is positive, and a lot of the tightness that they're feeling might not actually be muscular tightness. It's probably neural tension. And if we clear that neural tension, their leg, their hamstring, their calf, whatever it is, might not feel so tight anymore.
Tension or tightness is a feeling, right? So our nerves are our messengers of the body. They tell our brain what's going on and regulate appropriately to try to protect us. So if for some reason, whether it's your neural pattern or your movement patterns, or certain postures that you're in, that your brain has formed some sort of protective mechanism against, then your brain's going to go, whoa, I don't want you to do that. So for example, with if we're talking about the hamstrings, your brain's going to tell you not to stretch your hamstring, and it's going to kick in that neural tension and say, hey, that's tight, don't stretch that. And so this can affect our mobility, whether we're talking about the hamstrings or really any muscle we're talking about in the body. We mentioned before about movement, blood flow, and space, right? So the nerves need the proper amount of that to function properly. So what happens when we don't have that? I like to think about the nerves as wires carrying information, and so we can get error messages if the nerve isn't functioning properly. And so that error message is going to be pain, numbness, tingling, some sort of abnormal feeling somewhere in the body. And many of us are familiar with this if we fall asleep on our arm incorrectly, or our leg falls asleep because we're sitting cross-legged for a long period of time. That is a small example of what happens when a nerve is cut off from its appropriate amount of movement, blood flow, and space. And so if we think about endurance athletes and runners who are doing repetitive activity and following the same movement patterns over and over, anything outside of that range of motion that we're using consistently is going to send that message to the brain like, whoa, we don't have that range of motion.
Yeah. So essentially the nerves can get stuck in the fascia. It can get stuck as it's coursing around a bone, or it can get stuck in muscles or muscle tightness. And if that nerve doesn't move, it has about 7 millimeters of movement in either direction. If it can't move, then that's where that input starts. So that's when you'll start to notice tightness in the area. That's when you'll start to have more trigger points. So if you find yourself rolling out on a lacrosse ball on your butt or on your shoulder, wherever it is, over and over again, it's something to consider that maybe something's happening from a neural tension standpoint, because you can get neural tension anywhere. You can get it in your leg, in your foot, you can get it around the knee, you can get it in the shoulder, neck, arm, all of that.
Yeah, so I think it's really pertinent that you bring up trigger points going along with neural tension. So that's part of the error message that I was talking about too. Mm-hmm. So if the input to the muscle isn't correct, it's going to affect how that muscle performs, how it functions, and we're going to get those trigger points or those knots in the muscle. I really need to take an aside to tell you that my patient the other day called dry needling muscle knot shots.
Muscle knot shots. Yes. That's funny.
I mean, it's pretty accurate. So you're putting a needle, which is kind of a shot. I guess we're not really injecting anything, but you're putting a needle into a trigger point, which is a muscle knot. So I thought that was very funny.
It was funny. I actually had a patient the other day say, we should not be calling this dry needling because it sounds so scary. It's actually really helpful. And it's true. And when you say, oh, I'm going to needle you, people kind of freak out, right? But if they haven't had it before, but if you say, hey, I'm going to release this muscle so that it can perform better and you're not going to have as much pain maybe in this area, then people are on board.
Yeah, I agree. I'm often find myself over-explaining dry needling because I want them to be prepared because it's uncomfortable. But I'm like, look, this is the most effective and fastest thing I can do to help you right now.
Yeah, I'm definitely an over-explainer. Sometimes I'll be talking and then I'll be like, wow, how many minutes have I been talking? I really hope hope the message is through. And then we laugh about it. But yeah, when it comes to this type of thing, over-explaining is definitely an issue.
Totally agree. So getting a little bit back towards what we want to talk to our audience about in terms of neural tension, because this is one of those nuances where it's really important to go see a healthcare practitioner so that you can get the correct diagnosis and address the problem appropriately.
Yeah, absolutely.
Another thing to note too is neural tension can be the primary problem, but oftentimes it's more of a secondary problem where it's an issue that comes along with existing injury, or it's a component of rehab, not necessarily the
reason you come.
The reason you come, right.
Yeah, absolutely. So whenever anybody has back pain or any kind of extremity pain, so basically anytime anyone comes, I guess, I always do neural tension screening. I always look at it the first visit, second visit, because it usually is one of those secret things that hides, right? And so if you're not looking at it and you're a healthcare provider, you definitely should look at it, because it's one of those things that if you add that to your treatment, the patient will get better faster. And I think they ultimately have better overall results because you're addressing all of the underlying issues, not just where their pain is.
Something I think would be really helpful, I think for both our general running population, but mostly our healthcare providers. So when someone comes in and sits down in your treatment room, sometimes you can already tell they have neural tension.
I love this I taught in class.
Yes. So let's go over that.
Right. So you can tell if someone has neural tension by how they're sitting. So the happy star. So essentially, if somebody sits down and their knees are really wide apart, or they're kind of like lounging over the back of a chair, they're like just, their whole body is kind of like a star. I like to say happy star. Like, you have to think of that's probably their way of releasing some of that neural tension. So if you think about a nerve, it's almost like a rubber band. And the more you pull on it, the more it gets stretched out. So when somebody's sitting totally spread out, they're trying to relieve some of that tension in the system. And in order to test the nerve, you actually have to bring everything back. So when we do a slump test, which is a way to test the nerves, we bring their knees all the way together. We put their hands behind their back. Then we ask them to tuck their chin, slouch their body, and then extend their leg or make their leg straight. That's just part of how we do it. And there's multiple ways to do it, and you do it in different ways depending on what you're looking at. But when we do that, we're bringing everything back in and trying to get that nerve as tight as possible so that we can see if there's an issue. But if somebody walks in and they're lounging about, their legs are wide apart, their arms are over the chair, then you know, okay, maybe there's something else going on. Or maybe they're just really, really chill. I don't know.
Yeah, we don't want to put any labels on anyone here. But yeah, I love that you described the slump test a little bit. It's probably my favorite thing to do as a clinician because when it's positive, it's like a really cool party trick. So, you get everyone into their slump, you ask them to straighten out their legs and they go, oh no, my hamstrings. And you say, okay, lift just your head up. And they will give this wide-eyed look and be like, it's gone. The tightness is gone. And so what has happened there, so going back to our rubber band analogy, right? So if we think of that just really simplistically, and we think about a rubber band that's attached to the base of our head and then maybe our heel or even our toe on the very bottom surface of our foot. When we ask someone to lift their head up, we're slackening one part of the rubber band. And so that gives them this sensation of decreased tightness.
That's right. It's
obviously a lot more nuance in this. There's a lot of ways we can really pin down where is this tightness coming from. But that's kind of the basic way we test for it. And I think it's a really good example for someone who maybe doesn't do this regularly.
That's exactly right. Once you do the slump and you know it's positive, then you can change things around. And it's such a good test because the other thing, when someone comes in with back pain and they've got a lot of neural tension, I actually start treating their cervical spine a lot and thoracic spine because I find that relieves that tension more farther away from the area. If you can relieve some of that tension when someone is really acute or really flared up from somewhere else, they'll feel a lot better, but then you haven't aggravated them further.
Right. We used to talk about in residency as surrounding the fire.
Yes.
Instead of putting the fire out and attacking the fire, you got to kind of surround it a little bit. Maybe start on the outside and work your way in. And I do think of, treating the cervical spine, thoracic spine as a way to do that. And I mean, something we haven't really brought up is a lot of the autonomic nervous system is located in the thoracic spine.
That's right.
Which can affect tension throughout the body too.
Absolutely. And yeah, and that's why we treat the thoracic spine a lot. And you can treat the thoracic spine with manual therapy. You can treat it with movement, however you're best at it. I recently had somebody in the clinic who's a pretty complicated case, and they were having a lot of distal, so that's far away from the center is distal. They're having a lot of symptoms in their foot, for instance, and even some swelling and discoloration happening. We started treating the thoracic spine just really basically with some cupping and with some manual therapy, joint mobilizations. I haven't even needled them. And all of a sudden that's changing, which is really, really cool. So the foot's getting better. There's less swelling. There's less blueness. The skin is looking better. Hair is growing back on the leg. Like, it's incredible just to be able to see that kind of change by treating the thoracic spine. And the reason we can do it is because it is that parasympathetic, sympathetic nervous system.
That's incredible.
Yeah, it's really
That's
cool.
really, really cool. Mm-hmm. We do really cool things as physical therapists.
I know. And it's so exciting because when someone comes in and they feel like they don't, like they can't get better or something's really impacting their life, and then we're able to help them, it really is life-changing. And for me as a therapist, but also for the person.
Right. I think about physical therapists, and as myself as a physical therapist, as someone who shows a patient how malleable their body really is. Because I feel like a really common thing I see is, they think that once they get injured or once they have a certain amount of tissue breakdown, like it stays like that forever. And, they're just kind of chipping away at their body as they age. And it's just, we have some age-related changes, but the thing is there's so many things that we can do. And they've done studies on older individuals where they can do weight training and get stronger. We know that this capacity for change doesn't change. This capacity for change is constant throughout our lifetime.
Oh, yeah, I love that. And I actually love bringing that study up all the time because it's true. You don't have to be where you are. Like, there's always a way to improve your body. And, there are catastrophic things, of course, but it doesn't mean just because you're living with something doesn't mean you have to live with it in terms of an injury. And I do think that that's one of those gifts that we get to give to people a lot. I can't tell you how many people just come in, whether they're athletes or not, and say, I'm just old. This is me being old. And then when they feel better, they said, I didn't know I could feel this way. And neural tension is one of those things that really can impact how a person moves and feels overall in their system.
Yeah, because like we said, it's so wide ranging, right? It's everywhere in our body. So you can think about how much, if we can change something that has an effect on the whole body, then a person's going to feel and move better.
It's true. And, I had another patient case where the person had bilateral, so both legs had a lot of hamstring tightness, and for a long, long time, just wouldn't go away. I ended up treating thoracic spine, of course, but then I moved up and treated the cervical spine a lot, and all their hamstring pain went away. And it was because it was neural tension, and it was absolutely 100% neural tension related. I mean, I did some gliders and sliders with them and some slump work, but it was really ultimately treating that cervical spine that got the hamstrings better.
Yeah, it's so cool. Everything's connected.
Everything's connected.
Well, so we're talking about this today because we did a little bit of research on our most commonly clicked on blogs.
That's right.
There was both Kate and I had written a blog about this, but more recently I'd written about neural tension, and it was one of our top hits. My guess is, I could be wrong, but I'm thinking that people are wondering about this for the case of like glute pain, sciatica, that sort of thing, because that's something I think that is often misunderstood by the common population.
Yeah. Many people come in and they say, I have sciatica, and it's not really sciatica. Their sciatic nerve might be sensitive. Absolutely. It might not be sliding or gliding the way that it needs to be, but it might not be sciatica. And you're right. I think that people are searching for, how do I get rid of this butt pain? How do I get rid of this sciatica pain? And neural tension and neural mobility is a way to improve some of that.
And the thing I want to emphasize too is that you have to get this diagnosed correctly.
100%.
So, searching on Google or YouTube for nerve glides can teach you how to do a specific nerve glide, but they have to be done in the correct way with the correct combination of other treatment.
And also, we mentioned earlier that you can make yourself worse by doing too many nerve glides. And if you're Googling it and finding it on the internet, it's very possible that you're going to end up doing too many, or maybe not the right sequencing, or, not the right nerve even.
That's right. So I tell all my patients, well, not all my patients, but your new Google is my email. Like, email me. Please do not Google anything.
So true.
It's so true.
That's the thing, right? Is there's so much information out there and you don't know what's good or bad. And a lot of it's so good. Like, the information is so good out there, even, when you're Googling it, but it might not be for you. It's not individualized. And every person's different. Every body's different. What we expect out of our bodies are so different that just getting it on Google really doesn't do the trick, even if it is good information.
So one thing I think we need to talk about is, how does someone know that maybe they have some neural tension? What kind of symptoms? What will they be feeling? Like, so if someone's listening to this and thinking like, wow, I think I might need to get this checked out, like, what would you say to that person?
Yeah, I think that the common symptoms are tightness. So just we talked about, I keep using the hamstring because it's the most common one. Tightness, there's aching. Sometimes it's deep aching, but usually it's just a general ache. And it's an aching in a pattern. Like, for instance, if you had stuff going on with the median nerve, which is in the upper extremity or the arm, you might find that you're getting a little bit, your upper trap is really tight. And you're getting a lot of trigger points in your upper trap. And then you're starting to notice that your arm is getting a little bit achy, and then even maybe down into your wrist. And again, that could be neural tension. It could also be a cervical spine disc or something else. There's other patterns that follow that. So it's not to say that it's exactly what you have. And this is, again, why individual evaluations are important. But you might start noticing that it's traveling in the line of the nerve. And you might end up with more trigger points in that area. So I think that, that's it. Like, tightness, traveling pain in a pattern, achiness. Yeah.
Right. And so when we hear like people saying numbness, tingling, burning, we know that those are usually descriptors that describe a nerve issue. And so that's always going to tip us off to looking at neural tension as well.
Those are the most obvious ones. Of course, I didn't put them out there.
That's okay. I'm here to pick up your slack.
Thank God somebody is. Oh, that's funny. The other thing is, I learned a long time ago in my residency, if somebody has pain in one side of their body. So if they always injure their left ankle and then their hip on that side is really bothering them, their knee, or just they have a lot of things that always end up on one side of the body, usually I'll look for neural tension or look at the nervous system on that side of the body as well, because it's like that nerve along that nerve root has been affected. And so we need to take that into consideration.
Yeah, and I remember when I was a patient of yours, and I hadn't gone to PT school yet, so I didn't really know. But you told me that when you injure a particular muscle that is innervated by a certain nerve, you're more likely to injure nerves along that same that are innervated by that same nerve along that same chain.
Muscles on that same chain. Yeah, not nerves. Yep, that's right. So there's something called double crush syndrome. That's what it is. Dun, dun, dun. Dun, dun, dun. But it's way more complicated than that. So it's not exactly that. But yeah, so if you injure a muscle or an area along one part of a nerve, you're more likely to do something later down the chain. It doesn't always happen though, because I don't want to be totally negative and say you're going to get injured here because you've already had an injury. It's just sometimes happens.
That's a lot more nuanced than that.
Yeah. It depends, right? So
Our favorite answer.
Yeah, that's right. Because everything's so individual. We just say it depends. And I say that in class every time I teach and someone asks me a question and everyone hates it, but it's true.
That's how I sum up my physical therapy school experience, is it depends.
Funny. Is there anything else you think we need to talk about in terms of neural tension, or things that people out there might be wondering. We discussed the sciatic nerve a little bit and back pain and how neural tension can be anywhere.
I think just bringing some awareness to it is helpful, especially for people who maybe are kind of stuck in their injury patterns and can't really, they're, doing all the strengthening, doing, the quote unquote right things, but aren't really getting the success that they want, that maybe this is something that you need to get looked at. I hope that people feel a little bit more educated and like they understand what might be going on when we talk about neural tension or when they're Googling about neural tension.
It's not a magic bullet, though.
It is not.
It's not a magic bullet. Usually, and we always do it in conjunction with other things, whether it be strength training or manual therapy or dry needling, whatever it is. So neural tension is just a piece of the picture, a piece of the puzzle. But I think it's an important piece, especially when there's been persistent pain in our athletes. Well, thanks, Kacy. This has been fun.
Yeah, we did it, Kate.
Woo!
Woo!
All right, guys. Well, thank you so much for joining us. We'll talk soon.
Talk to you later. Thank you for joining us today. We're so glad you're here.
If you love this podcast, please show us some love and write us a review. We're totally serious. Write us a review and subscribe wherever you listen to your podcast. It really helps us to increase the visibility of our show and reach more endurance athletes everywhere.
And remember that training is so much more than miles.
See you later.
See you later.